Hi, it's me, Ingrid INFP, and welcome to my ISFJ friend's house. We are going to be talking in the series about what I learned during the heart-lung days, which was basically 2 days about the heart and lungs, with like the most famous researchers in the country. Basically, it was there were some of my lecturers from Karolinska, the school that's in Stockholm, but also people from all across the country, and it was amazing to just see these people, pretty nerdy people, but also, you know, it's pretty funny to just see them like in their regular lives, you know, because a lot of them were just sitting in the lectures while watching other lecturers go. So it was pretty cool. Some of these are TV, like are often on TV, you know, there are certain doctors that do a lot of TV media stuff. So it was interesting to meet them as well. But yeah, so this one is about radiology, and, well, not radiology only, it's about basically, is disease, like, if you see disease on a screen, does that mean that you actually have a disease? And that's what these three lecturers we're going to be talking about. So this one is about lung noduli and pleural plaque. So the lungs have, when we do a X-ray of the lungs, we often can't really see much in a regular X-ray, but a CAT scan can see the lungs. And so, yes, I'm wearing, obviously, this shirt. And often, when we do X-rays, we will find things that we weren't expecting to see. And then we're like, oh, why did I even do this? Now I have to figure out what this thing is. So often we will find a lung noduli. Nodulus is the singular form, and it's basically a little dot on the X-ray screen when you do a CAT scan, and it could be anything. It could be very nice things, such as a granuloma, basically scars after an infection. It could be lymph nodes, like they could be nice lymph nodes, but they could also be bad lymph nodes, basically metastasis, or sarcoidosis, which can be treated, but is not as good as the others, I guess. Or it could be lung cancer, and it's hard to know, you know. So what are the good things? The good things is if the nodule is round and regular and has clear borders, and if it is less than 6 millimeters, then we're pretty like chill, you know. If it's over 3 centimeters, then it's definitely a tumor, basically. And the people who are at high risk, which we need to check this more carefully, are people who are, like, smoke a lot, people who are women, because their lung cancer is a little bit more strange than men's, basically, people who are old, people who have COPD or fibrosis in their lungs. And when we look at the X-rays, we need to check those noduli that aren't that clear, that are in the higher lobe, like in the top of the lungs, not at the bottom of the lungs. Because at the bottom of the lungs, it could be all sorts of different things, like after an infection or something. But if it's up here, it's more likely, unfortunately, to be tuberculosis or cancer. So that's not great. And they call the nice ones basically solid. 95% of these noduli are solid, and they're often nice. Then there's ground glass, which is often it's described like milk and water, so it's very, very diffuse, like a cloud pretty much. And they're often nice, but then there's a semi-solid or part solid, and they're the ones that are at highest risk of being cancer. So we need to control these things at different intervals. So if there are a lot of them, like several of them, not just one, if they're over 6 millimeters, if they're semi-solid, we need to do these controls. And there's a whole chart of how often to do that. Which a control is basically a new CAT scan. Pleural plaque are often because of asbestos, and it's the pleural sheet that covers the lungs. Often older people, people who smoked a lot, men, often because men worked with asbestos. But in lower income countries, often women will have pleural plaque because they are in badly ventilated kitchens and inhale a lot of particles. And itself is not as bad of a thing as having lung cancer, but it's still not great. So yeah. And so that's about CAT scans for the lungs. When it comes to CAT scans and ultrasound for the aorta, often we find asymptomatic people with a wider aortic root, basically that starts from the heart and it comes down like this, the aorta. Well, I don't know if I'm doing this the right direction, but the aorta goes like this and around. And here, if it's widened here, then it gives a risk for aortic rupture. And, you know, you don't want your aorta to rupture. That would suck. Basically, you can die from that. So people are asymptomatic, but then they have this extra risk. But we don't know which people who have a dilated aorta have more risk. What we have seen, the only factor that we can see is people who have a dilated aorta and high blood pressure are at a higher risk for a progression to a rupture goes faster. Otherwise, we're not really sure. So it's basically that they're doing a lot of research on that, and we're not sure about anything yet. And the third one in the series was about coronary artery disease. And I did a little picture. That's the logo from the study that they did. They're like two little guys with a little heart in the middle. I was pretty bored by that point. But basically, when we do these measurements, sometimes we'll find arteriosclerosis, which is basically blood, fat, cholesterol plaques that are like lining the surface of your blood vessels. And that can lead to heart attacks, it can lead to strokes, it can lead to blood clots. And the best way to treat that, or to stop those clots from happening, is by using statins. And statins lower your cholesterol and basically stop the arteriosclerosis. And we should use statins, especially if there's a lot of conglomerate of this arteriosclerosis. But otherwise, it's like, well, these people who have arteriosclerosis are very, very common. A lot of people have this in the Western world, at least. And they don't know about it until later. So that's why it's like, the question is like, how should we screen for these sort of things? Should we screen? We don't know yet. So a lot of these were like, we don't know yet. Okay, well, and so that was for this part. The next part is actually about hormones and heart-lung disease. So that's a pretty interesting, kind of unusual part. So I'll see you next time. I'll be doing that as a next part of the series, the 5th part. Have a great day, everybody. Bye.